Welcome to the module about matching insulin to physical activity as part of our online education program. Physical activity is extremely beneficial to patients with diabetes mellitus. It is the poly pill of the 21st century. But diabetes patients, especially those who have an insulin treatment or are treated with insulin secretagogues, have to be aware about experiencing hypoglycemia during or after physical activity. To understand this relation, it is worth to attend this module. At the beginning, we will shortly review the physiology of physical activity in healthy individuals and diabetes patients in terms of glucose tolerance. How affects a very short but intensive physical activity the blood glucose value compared to endurance activities over hours? Which kind of activity or which kind of treatment regimen has a higher risk of experiencing hypoglycemia? How can I prepare myself to not get a hypoglycemia when I will become physically active? How can I reduce insulin dosages over what time, and what should I do after physical activity with my insulin injections? Special emphasis will be given to a patient with insulin pump treatment and to the risk of ketoacidosis. Yes, there is a risk of getting hypoglycemia during physical activity, and yes, this is dangerous and is affecting patients' quality of life. But on the other hand, there is also a very clear yes to physical activity, because the pleiotropic effects of physical activity are far bigger than the risk associated. Therefore, it is important that the patient gets educated how to be prepared for physical activity so that he can learn all its benefits. A final remark will be given about patients with diabetes associated complications. Also here, physical activity can become very beneficial to those patients in reducing the progression of diabetes-associated complication. But a special emphasis on being prepared is necessary. This module will help you to assist your patient to be prepared and to become physically active safely by adjusting insulin dosages.